Dr. Katie, we've been talking a lot about schizophrenia today.
Yes.
I want to know more about what the Katie Wellness Institute is doing to improve brain health, not just in schizophrenia.
Thank you. It's a topic that's very near and dear to my heart. Our tagline for Katie Wellness Institute is integrating mind and body for peak performance.
Okay.
And our mission is manifested as the intersection of three specific domains. And interestingly, these are the only things that a psychiatrist can do, or really any coach can do, to improve mental and body performance. And that is mind, the psychology; body, the actual biochemical realities of what's going on;
Okay.
and behavior, what the patient does with that. The first thing we do is we look at what's going on with them on a functional biochemical basis. That includes hormones, nutrients, antioxidants. I don't reflexively assume that they have a Prozac deficiency when they walk in the door. It could be a hormone deficiency, a thyroid deficiency, an adrenal deficiency, a nutrient deficiency, a food allergy. So I like to, and I believe that this is conservative practice, I like to support the structure and function of a patient's body with anything that they need, anything that they're missing, and start them that way, and then use medications as needed. In terms of brain health, if it is bad in terms of brain health, if it is bad in terms of having a psychiatric diagnosis, it has got oxidative stress associated with it. So frequently, and speaking now specifically to patients with schizophrenia, frequently patients with schizophrenia do not eat the best diets.
Many of us don't.
And particularly if you're on a medication that gives you the munchies and you're eating lots of carbs. So far, I have never met a patient that craved fruits and vegetables. Or craved burgers. I'm talking about the meat, not the buns. They typically crave carbs. So if you eat fruits and vegetables and increase your antioxidant levels, you'll be ahead of the average American out there eating at the Golden Arches and other places.
Yeah.
So that's part of brain health, is a good diet. And it's not just the antioxidants that you get, but if you eat well, you don't spike your blood sugar as high, you don't get the metabolic aspects of poor food choices, you don't get weight gain, and actually now they're looking at a concept of diabetes in the brain, where your insulin receptors in your brain are resistant, and therefore it takes more glucose in the brain to feed the neurons. So good diet. And then several other things. Fish oil is really big. Omega-3 fatty acids, or PUFAs, polyunsaturated fatty acids. And then people can look at EPA and DHA. So in schizophrenia, I think everybody would be wise to make sure that the patient's fatty acid level, the essential fatty acids, EPA, DHA, are good.
Usually no side effects, and easy to take.
Right.
A lot of benefit.
Right. So that's good for anybody's brain health. So watching what you eat, good amounts of fresh fruits and vegetables, organic if possible, fish oil, vitamin D. We've talked about N-acetylcysteine, or NAC. It is a progenitor, or the cysteine is a progenitor for glutathione, which is the body's main antioxidant. So those are things to do. Things not to do, which are very dangerous in terms of brain health, marijuana.
Okay.
Now, there are some people that may be watching this that will say, well, what's wrong with the joint here or there? It's legal in my state, et cetera. There are now studies published that associate early use of marijuana with people having first break episodes of psychosis and going on to
Dealing with
schizophrenia
schizophrenia for life.
for life. Yeah. So if you're a young person or the parent of a young person
Don't
smoking
go there.
marijuana, don't go there. That's bad for brain health. And bad as that one is, the ones that are literally playing Russian roulette with your brain are the synthetic ones, the bath salts, some of the more refined or the chemically synthesized things that are supposed to give you similar effects of cannabis, but that are totally
That are
synthetic.
These are much more dangerous.
Right. And if one needs any encouragement not to take that, I invite the curious person to go onto Google, go to the videos, and type in spice or
SPICE.
SPICE or high on spice, and you will see people that are totally out of their minds on this, and
Wow.
and they can be assaultive. They're totally psychotic. And sometimes they never get better. One time and their brain is broken.
Yeah, and medications then for schizophrenia, probably for life.
Right. Also, sparing alcohol use, if any.
If any.
If any. So does that cover brain health for you?
I believe it does.
Okay.